turn by turn. Everything in life is turn by turn. Brother man, relax and wait for your turn. Everything in life is done by God. Yeah, yeah, yeah. Turn by turn. Everything in life.
Hello everyone, welcome back to the Sister Show. My name is Ceesay. Thank you so much for joining us for yet another amazing episode. And as you know, this is a platform where we bring you honest conversations to inspire and empower pretty much everyone. Of course, we do bring you burning topics that hits home. So stick around, we have another packed and amazing hour for you. If you didn't get the memo, we're all wearing pink, obviously. It's October. It's October, so it's breast cancer awareness. So we know that it's going to inspire everyone, every woman out there, and to be more health conscious, hopefully. And of course, we have a beautiful and amazing sister. This is a sister too. So
literally.
We just pushed Amy. Amy's not feeling well. Dr. Mams worked all night. So how ironic that actually we do have a Ceesay sister, and that's Ida Ceesay. She's our guest today. And we're so happy that she's here. We will also have another segment that we call Let's Connect. That's the new segment that we have, Let's Connect, and that will come up in a little bit. And the final and last segment that we all always wait for, of course, and you have to stick around for that, is the hot soup. And Ida has promised that she will stick around for the hot soup. So we will be definitely excited to see what she has to say on the hot soup topics that we have. And on that note, let's move right along into this amazing show we have for you guys. And we will start the game Let's Connect, and we will see who's going to be the loser. Certainly is not going to be me, I promise you that.
We'll see.
Okay. Well, maybe I'll lose to Ida, but I'm not going to lose to you.
It looks like she has a game face on. I don't know.
Don't let her fool you. She just pretends. But let's go ahead and introduce Ida. She's actually a true sister. We are related, Ida, by blood. She's also a Ceesay. Ida, can you tell our audience about yourself a little bit so they get to know you before we get to the game and to talk about the breast cancer, why you actually are here today?
Well, first off, I would like to say I'm a very sore loser, so I am not going to lose this game.
Such as
we're very competitive. But okay, hi everybody. Thank you so much, ladies, for having me, or I should say my fellow sisters for having me. It's a great, great honor to be here to talk to all of you guys. I am Ida Ceesay, Ceesay Ndiaye. I am a fellow breast cancer survivor, amongst other things, a mom, a businesswoman, a consultant. I think the one thing that is my passion is helping other people. I've been doing that for about 7 years now. I think that is, to me, that is the most fulfilling thing besides being a mom.
Yeah, that's a very Ceesay thing as well, to give back. Yeah. So thank you.
It is. So, you know, we do our part. I think we all have a footprint, and it just needs to be a good one. And you guys are doing an amazing job with that. So whatever we can do to help, we're game to help.
Thank you, Ida. So can you just tell our viewers about your organization and what's the name of the organization?
My personal foundation is called FACIA, which is Fighting Against Cancer in Africa. We do awareness. We help with support as far as cancer survivors and people who are going through the process of cancer. I also am the vice president of a newly formed organization, but it is more of a cancer league that we did in Gambia, because we found out that my organization included that we had several different cancer organizations that were spread out across the country, and we're all pretty much working towards the same goal. Mm-hmm. So we decided out of eight different foundations, we came together, and it's called the Cancer Associations League, the Gambia. We do our own work individually, but collectively we also work together, and we had an awesome Pink October last year, and we raised a lot of money, but this year, unfortunately, we can't do that because of COVID, but we're being creative with what we're doing.
Yeah. Thank you so much, Ida. We really, really appreciate the work that you're doing for our people, especially in Africa. It's definitely needed when it comes to health issues and so on. So thank you for taking the bull by the horn. So we really appreciate it. Talking about health, we figured it'll be great to actually play the game, which is on the Let's Connect segment, and we will see who here is more conscious. I mean, Ida, you and I see Olay. Okay, let me stop because I talk too much and then later I lose. Let me be quiet.
And
All
then
right, okay.
right?
I'm sorry. I'm just intimidated by Ule's face. She has this game face on. I don't know how that.
Don't even be intimidated by both of these ladies. I can tell you, Juka has the top and Ule has the face, but
So I'll win.
yeah, so you have a high chance of winning right now.
Well, I can make Ida win.
No. I don't want to be let win. No, it's got to be a fair fight.
Listen, Linda. Olay would not even do that. She's a Ceesay. When it comes to games or anything you already know, she's gonna try. She might not, but she'll try.
So I will lead the question with breast cancer, and this is almost a dead giveaway. So I'm just trying to be nice to my sisters so they don't sound too dumb. So, so which race has the highest breast cancer rate? Black, Caucasians, Asians, or Hispanics?
Blacks, of course.
I would say Caucasian.
Oh my God, Jay, this is not easy.
It's not
It's the
easy.
easiest
No,
thing ever. Oh my God.
Okay, I'll say blacks. I wanted to say Asian. No,
Okay, go with Asians.
Hispanic. All of the above.
That's not even an option. She already failed.
Okay.
Thank you for being not so smart. So blacks, I was trying to give you this up. So blacks has the highest. So
Really?
yeah.
Well, I was thinking we're more in the minority around the world.
So when you do the statistics, if you have 1,000 whites and 1,000 blacks and 1,000 Hispanic, so that's how you do the statistics. You know, based on the population. So the answer is blacks. Ole is the winner here. It's a leading question. So amongst those people, who has the highest death rate by what percentage? A, 20%, B, 40%, C, 60%, and D, 80%.
I think it would be blacks at 40%.
I was thinking blacks are 40%, but I'll go higher. Blacks with 60%.
I was actually also going to do black.
No, you were not. No, you
No,
were not.
I was black with 40%.
Cancel.
But I'm gonna give Ida a pass. So I'm going to go with, I'll say Caucasian 20%.
No, you did not let Ida win. You just lost miserably because you already, she said blacks, and now you go in Caucasian. You went west, east, and south.
Now, to do an analysis, Ole, obviously you cheated the first time because if you really had a rationale for your answer,
So again, I'm intentionally trying to lose so I can have Ida win.
She needs to stop making Ida win because Ida's going to win regardless.
say Ida just won, so it's 40% black.
Yeah.
See,
I
told
saw
you.
that somewhere before. I really did.
Well,
Thank you. It doesn't help if you just see it and don't read it. So let's do about breast cancer. Ida, I'm going to make sure you win, okay?
Okay.
So at what
and no cheating.
at what age are we required to get a mammogram as women to prevent breast cancer?
40.
40.
Ole?
Can I, it depends. Like if you,
No,
If you're
it's a simple question. At what age this is a test and you are in a hall, you have a transcript. At what age are you to have mammogram? It doesn't say if you have a high risk, it doesn't say anything else. It just says
Ole
flat
always
out
have
at
to
what
take a
age.
U-turn and come back.
be quiet. That's fine.
Okay, well, thank you. That obviously tells me you have not been health conscious about yourself. So obviously you did not listen to your primary care doctor or your OBGYN. You are supposed to get a mammogram at the age of 40.
40.
Thanks. Okay, and
My doctor told me.
Hey, I said
I
at
don't know.
35. Come on. At least 35 means 35 and up. So
no, it's either 40 or nothing.
There's something about Ole. Even when they tell you it's wrong, Dr. G just said it's 40. You're like, no, it's 35 and up.
yes, 35 and
Oh,
up.
okay.
Because I took mine at 35.
Well, you know, sometimes before we even say it, we believe it in our head. And so that's what comes out.
You have to have that confidence.
What is the definition of wellness? A, the absence of disease. B, the ability to function independently. C, the absence of disease and mental health. D, the absence of disease, physical, mental, and social well-being. So what's the definition of wellness?
D.
D.
I just gave that away.
I said it first.
So all
I
of
said
you
it
got
first.
that. So
I just said she said it first. Which is true. We'll give her that. She's right.
Yeah.
I think either probably is the winner.
I told you guys.
Who came in second?
You already missed one. Both of you missed one.
I missed one, but Ole missed one miserably.
Juka, you either miss or you pass. The only reason why I'm going to fail Ule miserably is the fact that she should have had her mammogram, and if she did, she would have known what age. I'm taking 5 points.
At 35. I told you.
You did it at 35, so you assume everybody's supposed to do it at 35.
35.
Look, Linda.
Well, on that note, let's head on to what Uday just said. At any age, if you find any type of a mass or any type of a lump or any type of a discharge that is not usual on these babies right here, you need to go check with your OBGYN, get a mammogram, and most likely followed with an ultrasound, regardless of what age you are. Or if you were to go have a breast augmentation or breast implants, you're always supposed to have a mammogram prior to the procedure.
Thank you, Dr. J.
I'll go into food since you guys all love to eat. Okay. Which one of these foods will be considered an antioxidant and great for cancer? Pepper, cumin, C.
What is cumin?
You just failed then. B. Okay, Ole, stop. C. Garlic, and D. Oregano.
What? What's the last one?
Oregano. Ole only knows black pepper, garlic, and tomato and onions to cook better.
I just know my basics.
Okay,
That's
I have the answer.
All right.
I think
Cumin.
I was gonna say cumin too. I think it's cumin.
Either you think or you know.
I know what. I think it's cumin. I don't know. I
Are
think
you
it's
sure?
cumin.
If you're a Ceesay, you have to be 100% sure. No.
Okay, I'm sure it's
N or
cumin.
what.
I am
Okay.
sure it's cumin.
Done
All
now.
Of course.
Well, I was gonna say Mark Cuban too. So, but
Cumin.
I can't with this lady over here. Okay, what's cumin?
You said
I was
Mark
gonna say
Cuban.
Mark Cuban, but
She said
maybe
Mark
I'll just
Cuban.
go with-
I don't know why that is usually mainly used by Indians.
Right. Does she know turmeric?
Usually spices have a lot of antioxidants, so I'm gonna say the same thing.
So you all got it. So cumin is actually cumin, turmeric. All of these are great source of antioxidants, and they actually are sold in capsules, and they also have anti-inflammatory markers. So even for those people that have arthritis, like knee pain, joint pains, they can use it. It comes in capsule form. You can also use it to help reduce inflammation. And anything that reduces inflammation, not is it only effective for diseases like cancer, but also really effective for heart disease and multiple other diseases.
You're gonna give us the last one, but turmeric, actually also, Ole, you probably don't know turmeric. But you could add it in honey. I do a facial with turmeric. I add it with honey.
Yes. So for all you beautiful ladies with all your beautiful skin, which one of these can be used as a facial scrub to help exfoliate but also brighten your skin? A. Onions. B. Eggplant. C. Rice flour. D.
He's a good poker player.
Garlic.
Wait, what was the question again? I'm
Garlic. I'm lost. I completely lost.
Which one of these can be used as an exfoliant to help with your skin in terms of brightness and help with reduce wrinkles?
There's no way in hell I'm putting onions on my face.
I'm thinking the same thing. I am thinking the same thing. I'm like, I'm not going to use that one. So I'm going to be old and wrinkly.
Exactly.
Rice flour.
rice flour.
Yep, I'll say rice flour. Like onions, I'll just put it like in my food. It's not
But
going in my
eggplants,
face.
doesn't eggplant have antioxidant, Jay?
Can you answer the question? You don't
I
ask
did.
the question to answer the question.
I said rice flour.
Okay, now I know you.
No, you said garlic.
So great. Thank you. I'm glad you guys, even though you don't use it, but I'm glad you guys are aware. So onions can be utilized in a different manner, but not necessarily for exfoliating the skin, because obviously that would be burning. You can use the onion water to help hair growth. And then eggplant can also be infused in water. Cut it into small pieces, put it in water, infuse it, and then drink the infused water. It can help with polyps and stuff like hemorrhoids for people that may have that. And garlic obviously has both antibacterial and antiviral. And that's why some people try to use it during the COVID, but I'll say be very careful because it will reduce your blood sugar levels, and it definitely can give you what is called hypotensive effect. That means it reduces your blood pressure. So you can chop it up, put it in a little bit of water, like half a garlic, and take it like that. And that can also help with cholesterol. And if you were to have yeast infections and stuff like that, it does regulate your system. So you may have less of that because of the fact that it lowers the sugar level. Now, rice flour is great for scrubbing or exfoliating, okay? And you can mix rice flour, you can mix it with brown sugar, of course, and then honey, and use it as a scrub, or you can use rice flour, coffee, real coffee, 100% coffee, and honey, and use it as a whole body scrub. Or you can also do a goat milk bath. Okay, you can just take.
Okay, Jay, I'm getting hungry. Stop talking about all this food.
And you can also dip that in water and soak yourself and scrub yourself. For all of those that have, I promise that I'll give you a little bit of tricks here and there with how to take care of your skin, and this is one of them.
Okay, awesome. But still, I think I didn't lose the game. Even though Ida won, but I didn't lose.
So technically, I did not lose, right? Because based on what justification Jay gave, so I actually won. So Ida and I are tied.
No. I'm not sharing my first position.
We are not in any technical difficulties in terms of questioning. We are not in technical crisis. We do not need your technical analogy.
On that note, technically comment below and let us know if you think Ole technically won this or she technically failed.
Yeah, Ida.
No, Ida won hands down.
On that note, while Ida is standing her ground, go ahead and move on to the next segment, and we will discuss a few things about wellness before we move on to the main topic of conversation, which is breast cancer. So, Dr. J, okay, the perception that people have about wellness, right, is just being healthy. How can you talk to Africans, especially Africans, us, what wellness is?
So when people talk about wellness, they always think about disease. If I'm feeling well, then that's wellness. If I don't have any disease, if I don't have any high blood pressure, diabetes, then I'm well. So wellness in general is not just the absence of disease. It's the complete state of well-being in terms of your physical, how you feel, your mental health, and your social. So your mental is basically more mental mind. Like when you say someone is crazy, that's also part of wellness. And then your surrounding that's around you, that's your social well-being. So even though you may be healthy physically, if you're mentally not stable, like if you're stressed, if you're in distress, if you're emotionally not stable, that would not be considered wellness. If you're also emotionally stable, you're physically healthy, but then your surrounding around you is not healthy, you're not in a healthy relationship. Let's say there's so much chaos within the family system, that is still not considered wellness. So it's a complete state of well-being for physical, mental, and social. So mind, body, and soul as a whole.
Sounds like then wellness is, like you said, the complete package. So it's not just the physical being. And for me, I, for a long time, just thought that, okay, if I was not sick and I'm not going to the hospital, then that means I have 100% wellness.
You're not alone in this. A lot of people feel that way. And that's why most people, just because they feel okay, they think everything is okay. They think they don't need help. They think they don't even consider the outside or their surrounding as part of their well-being. So let's say you're in a household. Okay, you're physically healthy, mentally you're stable, you don't have any distress, you're not emotionally imbalanced, but then you live in a household where there is chaos. Let's say you and your spouse are constantly fighting. Every time you fight, okay, there's distress. And every time there's distress, if you were to check your blood pressure, if you just want to see a physical exhibit that happens because of the fight, if you were to check your blood pressure, if you were to check your pulse, you'll see that all of that will change. And that's why you cannot consider that person at that time physically healthy.
From a personal experience, I remember years back, I hardly ever took all my vacation time from work, because a lot of time we're trying to save our vacation to go back to Africa. And we know like how long it takes to be in Africa. Usually it's like 4 weeks to 6 weeks. And I think there was 1 year that I did not really have to go to Africa, and I actually had to spread out my vacation time. And going back to work, I remembered I felt a sense of renewal. I was more energetic. I was obviously more productive. And from that time on, that's when I realized that, oh, actually, I guess there's a reason why vacation time is needed.
Right? That's right.
And so that's part of your well-being as well.
I think as women, especially when we start having families and having kids, we tend to care about everything around us, and we completely forget about ourselves. Even if we feel something wrong, we take Tylenol and we go away. But things are happening inside, and we don't really realize that we need a break ourselves.
This is something that I feel really strong about, right? Because I know from the culture that we come from, Africans generally, we don't talk about the importance of meditation. We don't talk about, we even think that someone that's doing yoga or someone that's into meditation, they're actually crazy, right?
Yes, indeed.
You get stereotypes, so you almost shy away from talking about these things, right? Because you are like an outcast. When even being in a chaotic moment and then just say, let me check in. I do it with my sisters, and they laugh at me sometimes because and I see their face, they're probably like, okay, she's crazy. But I'm literally doing that because I do know, like you said, vacation time. Maybe you're waiting for 3 months to take that 1 week. But for me, because I move so fast, right? So I need that.
I need instant vacation.
Within 3 hours.
Within the hour, from everything else. But I think it's important, like for us to really think about it, like, okay, in order to show up as my best self, I have to be my best. If I'm not my best self, right, emotionally, mentally, right, then I can't show up to anybody as my best self.
That's all. That's true.
You can't be what you don't have, right?
Right.
No, you can't. So to piggyback on what you're saying, since we're talking about wellness, I think also another thing that contributes or takes away from our wellness is our food. Some of us like our rice very much. Some of us like our breads and guilty. Some of us like our desserts too much. So my question to Dr. Jaye would be that, as you know, in a typical African household, we eat rice, lots of it, sometimes twice a day, and not a lot of vegetables. We cook with a lot of oil, but then we do that and we don't have physical exercise and we go straight to sleep. So what is your input, or what can we do to increase our wellness? And be mindful of some of the things that we put in our bodies.
It's amazing how different cultures tend to do different things. And for us, we just like the Asians as well. So we eat a lot of rice and even a lot of bread for some African Americans, or even some Africans, especially the ones that were colonized by the French. They love the bread and fufu itself. So fufu, but then, so anything, like Ida, you said something really important, and I always repeat that. That's my philosophy. You are what you eat. So if you put in your body a whole bunch of rice, a whole bunch of carbs, most of the time you see these men go to sleep. It's not because they're lazy, it's because of what they put into their system. So if you eat rice, what happens? You're going to just feel tired. You're going to feel blah. The next thing you know is because of the carbohydrate content. The next thing you know, you feel lazy, you fall asleep. And then in 4 hours, you feel hungry again because you stored so much sugar into your system. Because when you eat right, it converts into sugar, and that's how your body uses it for energy.
Okay. So Dr. Jaye, will it be fair to say, okay, if you sit in front of a bowl of rice, imagine you're eating a bowl of sugar. Is that
essentially?
Well, no, it would not. It would not be exactly the same. It doesn't necessarily mean that you are eating a bowl of sugar, but people. So if you eat rice, it converts to sugar, and when it converts to sugar and your body does not use it, it's going to store as fat. Okay, and that's why most people gain weight when they eat rice, and most people get lazy and tired and fatigued when they eat rice. So when you eat rice, you're bloated, you're full, you just want to fall asleep. But in 4 hours, you're going to be hungry again because that sugar level spiked up real high. Your body releases a lot of insulin to break down that sugar so you can use it as energy. Then the next thing you know, that sugar goes down and you crave for more. So your body is used to that sugar content. So the minute it's done, you're going to crave for more. But if you were to eat something, let's say something like protein or something that has more fatty content, your body is not going to store it and then use it again. Your body is going to use it right there and then it stays in your system a little bit longer. So you would not get hungry faster.
So are there some substitutes with rice? And I'm not saying I'm going to stop eating rice, but are there other substitutes out there? You can roll your eyes.
No, let's
not stopping.
I know you're not stopping, so I'm not even asking anyone to stop. There's something called My Plate type of diet plan. What that basically means, it's for people like you that feel like they have to have their bread, like Sister Ida and you that loves your rice. If you have to have rice just because of the taste of it, you can eat it in moderation. So you can have a My Plate. The My Plate is basically a standard plate that's divided into 4. So 2 of those sections should be all veggies. Good luck, Ole. And then the 1/4 should be your protein and the other 1/4 should be your rice. And if you do that, most likely you would control your portions in terms of the carbs, but at the same time, you'll still eat what you like to eat.
So I can do half the plate rice, half the plate beef or chicken, because you said protein.
I did not say half of a plate.
So I have a question too. So do onions, like saucy onions, count as vegetables or no?
Exactly.
Okay, so
like
I'm going to specify again. Let's say, Ida, you are cooking your yassa. Okay.
Yeah.
So you have broccoli, you have cabbage, you have a salad or lettuce, all on half of the plate. Okay, and the rest of the half, you're going to divide that into 2, which will be a 1/4. So 1/4 of that plate should have your rice, your potatoes, all of that should be in one section. And then the other section should be your protein. And the protein should not be anything bigger than the palm of your hand. Not your whole hand, but the palm of your hand.
But protein is not bad. I thought you said.
Ole, I beg, please, Jungle, listen.
No, so me, I'm confused. So
no, this one I can understand it.
Me either. So when you say the rice and the potatoes, how high off the plate can it be?
Exactly.
Is that what you're telling her? So
yeah,
this is your
you
rice.
can pile it up, right? You can go high.
This is your
so
rice.
How high can it go? Is the question.
Oh, how high? You guys are talking about heights here.
Yeah, we understood the quadrant. We get that. It's how high can it go?
So you're talking about heights. You're building a building.
Okay.
Essentially, when you
Luca,
start
don't
your
worry.
build.
I'm going to help them out as high as possible. But then guess what? You need to eat all your veggies, but your veggies and your protein should be all on the same height. So when you're done eating your veggies, then you go eat your protein.
Did you really hear what Jay said about the heights?
Hey, I heard.
We heard it.
I'm asking.
Okay, what did Jay say, Ida? I don't think they heard. What did Jay say?
Jay said you can make
She
it as
said-
high as you want.
Yes, but they all need to be equal in height. So does the meat need to be equal in height too?
See, Jay, let me help you with these 2 people. Jay is telling you that so that you can calculate in your mind that if I cannot eat all these veggies, I cannot eat all this meat, then I'm certainly not going to eat all this rice. So therefore, it should be low, not high.
No, so
You're very right, Dukat.
okay, I have a question, right? So I honestly cannot eat veggies. Like honestly, I can't. So are there like vitamins that I can take that will supplement the veggies?
Are you allergic to veggies?
Almost, yeah.
What happens when you eat veggies?
She just like tasty.
For people like Ole that don't like veggies, is it any better if you saute it and cook it?
The greenness, like I can't. So, but are there vitamins that I can take?
Yeah, there are obviously vitamins you can get from veggies. It's not the same as if you were to eat it. Not only the fact that you're getting vitamins, but then also you're getting fiber into your diet, and it helps your colon in terms of preventing colon cancer and stuff like that.
Okay, so in Gambia, where you can't get the broccoli and you can't get certain vegetables, what is a good African substitute from
There
what
is a
we
lot
grow?
of veggies in Gambia. Let's say you have lettuce, you have spinach, you have carrots, you have beans, you have a whole bunch of stuff. If rice is not something that you really like, if you're in the West here, there's obviously quinoa. If you're back home, you have fonio, which is findi. You have cherry. So you have maize, you have millet, you have a lot of those things that you can actually use. And I think our bakery system should introduce the wheat bread, like the ones that we actually
we do have it. There's a bakery chain that actually makes a lot of, they make couscous, they make corn. And so there's a variety of things that they do. Now, what I found out, which was really interesting, is that the only people buying the couscous are the people that were diagnosed diabetic. Everybody else is eating everything else.
I don't want to cut you up, but it's the same thing you and Ole here are having issues with. So this is what I tell you guys. Don't wait until you have a problem and then you try to fix it. Okay, minimize and eat in moderation these things, so I don't come in to tell you to not do it. This is what I tell my patients. It's much easier as a human being to try to limit yourself than to wait for someone else to tell you to. Would I like to eat all the rice, all the bread within 5 years, or would I like to spread it out throughout my lifetime? So you choose, what do you want to do?
Ida and I are going to work on it, right?
We are going to work on it, Ole. We promise.
But we'll
Ida, I have more than Ida than Ole in this work. Yeah,
we'll work with.
I have a feeling that Ida likes her protein, just like me.
I do.
I like that Jay was given like practical solutions, right? In terms of the food, especially like I was talking to someone the other day. I was like, fonio is amazing when you cook it like like grits.
It is absolutely delicious.
You make fonio like oatmeal, or like you would make your oatmeal in the morning and put like fruits and yogurt. So these are practical things that people can do, you know, to just make for a better lifestyle. So what about the wellness? Because obviously we were talking about this, Ole, and Ole was like, how can someone in Africa do practical meditations and you know, they probably wouldn't be doing yoga poses and stuff, but at least to meditate, to check in back with themselves. And I was like, go to the farm, but she was laughing because she's saying most people, that's what they do anyway. So what can they do to get out of that? So let's say, what are some of the practical things that you guys would suggest?
Took a great point. And what people tend to not understand is the fact that praying is a form of meditation. Praying in itself is almost like yoga. When you look at the Islamic way of praying, it's very similar to yoga, because you are into yourself, you draw yourself closer to God, and at that point, everything else within the universe is shut off. So and you're doing it 5 times a day if you're doing it actually the correct way. So that's prayers is one aspect. So all those Muslims that pray, they shouldn't be laughing at people like Juka, because actually they are also meditating and it's new to them. So when someone else sees them from the West, they're like, what the hell are they doing, bowing down and going up and down? But it's a form of meditation. So if you are not into prayers and you're not a Muslim, obviously find a peaceful environment that you can.
And Christians go to church often, no?
Yeah. Christians go to church and they also do the beats, and they also find time to pray for themselves or their families. So anytime you find yourself in this sacred place that is lonely, quiet, peaceful, that you can pull yourself together. You don't even have to go to the farm. You can just go outside at night and just look at the stars. Right? Or you can go to the beach and just lay down there, or just
that is my favorite thing to do.
Yes, and just watch the water.
Yeah, for me, what I've recently been doing with the COVID-19, we all know our world just literally changed, and I had to do with a lot of stress, like with everybody pretty much at work. I was working like 19 hours a day. As Africans, we are very, very, very resilient people, right? So that has been kind of like what I fall back on. I can do this. I'm resilient. This time it felt different. It was extremely stressful. So I had to figure out like my well-being. So I learned about this thing called the miracle morning. And basically what the miracle morning is, 5 things that you would do every morning. And you could just pick like how long you want to do it. It could be 5 minutes for each of the activities because it's in the morning. So doing the prayer will count towards that. The next thing that I do is I actually do meditation, and I have like some music that I listen to, and I try to be present.
COVID is horrible, but hallelujah to COVID. Ole is meditating. Thank you.
Whatever you got. Right, so I'll take 5 minutes just to be present and meditate. So that's the second step. The third step is I do affirmation. It's kind of like Yuka finding feminine energy, right? So, and then the fourth one I do is I make sure I kind of find like 3 things that I'm always grateful for. And then the fifth one is you have to get your heart racing. So I do exercise actually. COVID again, right?
Like I said, being grateful helps a lot. Yes, people were like, well, why are you in Gambia? Why are you in Gambia? I found it a lot more calming to me to be there. And you know, despite all the chaos in the world, I was grateful for where I was at that point. And I think that's also part of wellness for us to look at our surroundings and be grateful.
I keep emphasizing on this because I know how we are as Africans. If we're used to eating jollof rice, that's all we want to eat. We don't want to try a new food. If we eat a chew or damada, which is a Gambian food, if you're watching and wondering what that is, we want to stick with that. We don't peanut butter soup. We don't go outside of those boxes that we are familiar. I think we have to be willing to go outside of what we are used to if we want to grow as people, because we cannot stay stagnant with the same things that we've known for so long and then think that we are growing. We are fooling ourselves if we think we're growing. And I say all of this to say this. When I talk about meditation, Ole, there was a time when you were judging, you thought I was crazy, right? But
at that point you were crazy actually. But
yes. I'm always crazy and I'm going to continue to be crazy. But I remember visiting in Africa, and my aunt and my mom, my aunt was going through something around that time. One of her children was sick. And I remember being at the hospital with my mom and her, and this woman was just tired. You know how African moms are. They drive themselves to the ground.
Yes.
When I looked at them and I was like, why don't I teach you guys how to meditate? They were laughing. My mom was laughing and she said, start with your aunt. I started telling her, obviously, going through the steps of meditation, close your eyes, watch your breathing and all that. 1 minute, this woman was sleeping and snowing. Like, that's how I exhausted. That's what it did to me. I was like, oh my God. Literally, this woman, it was in the middle of the day. She fell asleep on that bed that she was sitting, and she was just like nodding. Yeah. And I was like, Mom, she's sleeping. And then my mom was like, okay, let me try it and see. Of course, she didn't sleep right away, but she loved it. And I'm so grateful that they listened. So I'm begging everyone that's watching, please try to expand your horizon sometimes. So, certainly, I think Ole did, and you do, and Jay, of course. So we are hoping that all the sisters, if you're watching, please comment below. What are the practical things that you have been doing to actually reconnect and be grounded and get away from this world and just be back in your own little world by yourself, if that makes any sense. Yeah. So on that note, we will move on to the next segment. So now it's time to really get into this conversation of the reason why we are actually here today, which is breast cancer. But of course, we want to hear our sister's story, Ida. She is a breast cancer survivor. We are so proud of you, Ida, and we are so honored and happy that you're here to share your story, to spread awareness, especially with our audience and every person or every woman out there. Ida, can you tell us a little bit about your story?
Well, I am very honored to be here today and grateful to be here today because, like they said, it's always 2 sides and it could have been worse. So my journey started July 19th, 2013 is when I got my diagnosis. I didn't feel anything. I didn't have any symptoms externally. There was nothing physically wrong. I actually felt a lump one day. And as you know, I don't have big boobs at all, but I felt it towards the chest wall, and I thought it was a cyst. One of my friends came over and we were watching a movie, and I said, and she's a PA. And I said, hey, can you feel this? She goes, you just want me to feel your boobs? And we were joking about it. And she felt it. She was like, well, it doesn't feel like a cyst because it's not fluidy. She said, but let's watch it a couple of days and then we'll see.
So Ida, when you said a lump, like was it something hard and big, or did you just come across it? Like how did it feel, and how did you know that there's actually a lump in there?
It wasn't big. It was, all of us have had a boil before. Mm-hmm. You know what a boil is? Okay, it felt like a boil, but it wasn't hurting in the breast, but near the chest wall. So it almost felt like a little boil, if that makes sense. That's what I felt. But then when I asked my friend, she felt it. She goes, a boil is full with fluid, so it feels a little bit more fluidy. Well, it didn't.
So I'm going to explain a little bit more so you guys understand the difference between a cyst, a boil, and something that's a lump, a breast lump, as terms of cancer. So when you feel you palpate, in the terminology you say, you palpate, if it is a cyst, you can almost feel a little bit of a fluctuant. That means it will have a little bit of a bouncing effect. Like when you push on your veins, the way it feels, that's not a solid object. You can always tell the difference. Now, if it's a cancer cell, if it's not just a cyst, and even if you feel like it's a cyst, it's not a cyst, I would say it's always better to go seek a medical provider. If you push on it and it's hard, almost like a rock, if you feel on it, it's a little bit different. The two does not feel different. If it's fluctuant, that's usually fluid filled. It could be a cyst, it could be an abscess, which is a boil. If it's a hard, and you have to be able to differentiate the two. Just a regular person, like she said, she only felt something that felt like a cyst. So if you feel anything that's different, or have a discharge that's different, or never had a discharge, or you're not breastfeeding and there's a discharge, obviously go seek help. And that was great that you asked your friend to look at.
You just said discharge, so, because I've never heard of that. So discharge from the breast?
Yes, there are multiple different types of breast cancer. You can have a discharge from your nipple instead of a cyst feeling, or a lump feeling, or a boil feeling. You may even have a redness on your nipple. These are all different types of breast cancer, depending on what part of the breast it's affected.
Well, thank you, Dr. Jaye, for explaining that part. Well, after we did the biopsy, it came back that it was cancerous because of the type of cancer it was, which she can elaborate on what type. Mine was very aggressive. I went back in on the 30th from the measurements they did when they did a biopsy, and they stage it. So when they staged it from the 19th through when I actually went back on the 30th, it went from a stage 2 to a stage 3. So my protocol was completely different. Instead of doing surgery to remove the lump and then chemo, I had to start chemo immediately to shrink the tumor before we started chemo. So I'll let Dr. Jaye explain that.
Great, Ida, that's really great. So whether it's breast cancer or any type of cancer, most cancers progress differently. Inflammatory breast cancer, which does not have absolutely no lump, it's almost like a cellulitis, which is an infection on the skin, and most people will usually confuse it with a cellulitis or an abscess. Those are very progressive, and there are other types of cancers that are tumorous cancers too in the breast that are very progressive. So she's right. Some women may actually just have a chemo and that will be it. Some women may have radiation and chemotherapy. Some women may have surgery and then chemotherapy. But if you have a progressive cancer, wherever it is, so the key to the treatment is to take all the cells out. That way you don't have the chance of metastasis. That means the cancer spreading out to other places and becoming more dangerous for that person. Every individual is different, and that's why you have oncologists that will look at what type of cancer they do the biopsy, diagnose the type of cancer it is before they go into which protocol to use.
So Dr. Jaye, it seems like there's a lot of information out there and there are a lot of cancers out there. So can you just tell us more, like what exactly is breast cancer?
And a lot of people have these questions. They always think like it's some kind of a foreign object that flew into the person's breast. So basically it's just a cell in your breast that grows out of control. So when cells grow, they're supposed to grow to some point and die and then recover and another cell comes back on. But these cells, they just continue to grow and nonstop. So they change structure. When they change structure, then they become cancerous for whatever reason. It could be genetics, it could be environment, it could be multiple different factors that can cause these cells to grow nonstop.
So you mentioned that some of it is genetic, right? So either did anybody in your family had breast cancer before, or were you like the first one?
You will understand and you'll attest to this, that our families are not very forthcoming when it comes to family medical history. I didn't know anybody who was close to me that actually had it. If they did, they hid it very well because they normally are not very forthcoming. So I did the test and they couldn't find anything. I think it was called the BRCA test.
BRCA test, yeah.
BRCA test, there you go. So BRCA 2, yeah. So it did come out, the one I did come out that it was in my family, but we couldn't trace who. Well, after that, I actually started asking questions. Come to find out that my aunt, which is my dad's sister, that's actually what killed her. But of course, you know, the taboos with African culture, they said something totally different was wrong. So it is in my family, essentially, on my paternal side.
It's almost like when something goes wrong, nobody's supposed to talk about it, and that's just how it usually is.
Exactly.
Unfortunately. But I wanted to ask Dr. Jaye, like, are there instances where this is the first person that have it in the family, is nothing with genes and so on?
It can be environmental. It could be something that happened. Let's say, for example, if the person had radiation exposure from whatever the reason may be, or even a previous type of cancer from somewhere else and had radiation treatment and they were exposed to it, they can actually have change in cells, and that can cause, like Ida said, it's always great whenever you are diagnosed to actually go do the gene test to find out if it is related to that type of cancer, or if it's just environmental, or if it's just something. Because if you do, you can definitely save somebody's life. Like, let's say your siblings can all be tested, male or female. This is the thing that people think, that only females have breast cancer. Males can have breast cancer. And there is a risk factor for certain people, like the Klinefelter syndrome. These are all other diseases that men that have those type of disease at a higher risk of breast cancer, or if their family history are also higher risk of breast cancer.
So Ida, being that recently been to Africa, how common is breast cancer in Africa? And also, Jay mentioned that in the US, your health insurance can cover some of this testing, but in Africa, we know that there's limited resources. So how are women that are diagnosed dealing with the cost associated with cancer, since there's really a limited resources with the healthcare?
Well, so I'm going to give you a brief statistics, and this is based on the event that we did last year. Initially, we said we were just going to screen 300 people for breast and cervical cancer. We ended up, with the demand, we ended up having to do 402. Out of those people, we had 16 that were stage 4 breast cancer. Overall,
that is crazy.
Yeah,
it is. This was stage 4. We had 16. Well, overall, out of the 402, we had 300 people that were positive, meaning some were breast cancer, the other ones were cervical cancer. So what we found out was that people who actually came knew something was wrong with them, and so they came. And then we had 32 that were suspected cases of cancer. We were overwhelmed as far as what to do, because in Gambia, they cannot diagnose it. The only thing that they can do is, if they feel, for instance, breast cancer, is to do surgery. If you needed radiotherapy, if you needed, chemotherapy, you'd have to travel to Senegal to do this. Now, it is very expensive, as you know. Chances of you having somebody there, accommodation, food, transportation, and then you have to deal with all of this became, very hard on women, even though Senegal loaned us the machine, the mammogram machine, for us to do this. And some of their doctors were extremely gracious in helping, treat some of our patients. But our health system is not equipped at all to help cancer patients. My organization has helped so many people. The Cancer League has helped so many people go to Dakar. But by the time they get there, it's already too late and there's nothing they can do. So Senegal is now having to say, well, if it's a stage 4, I'm just sending you back home to go die, essentially.
Wow. And Ida, I am so grateful for what you're doing. This is wonderful. So I just have a question before I come in terms of the treatment plan and all that stuff. So the women that came to you,
yes,
they were already aware. So
yes,
at this point, they knew there was something wrong, but they
yes,
did not go to any kind of medical place to seek help.
The audience knows the realities of what is on the ground. She came to us and her breast size truly would be the size of a small watermelon. No kidding. And when you know when it starts coming out of the skin, it has already metastasized. And so I asked, I said, you know, how long has this been going on? She said it's been more than a year. She's gone to different doctors and all they can tell her is they're going to cut it off. And she's afraid of them cutting it off.